Good evening and welcome to League of Women Voters Presents. I'm Jim Robertson and our program tonight is on the upcoming 2014 legislative session in the Missouri Legislature. My guests are Chris Kelly, he represents Columbia in the 45th District of the House of Representatives, and Caleb Rowden, who also represents Columbia from the 44th District in the Missouri House of Representatives. Thanks for joining us tonight.
Glad to be here.
It's a pleasure to be here.
You know, as sure as the calendar turns, another session of the legislature is going to start about the first week of January. And you two have been working all summer, well, some of you have worked all summer, on some legislative priorities that they're priorities of the governor, I know. And I want to talk about a couple of them tonight, and then we can talk about things you want to talk about. But the first is Medicaid expansion. As part of the Affordable Care Act, the federal government wants to expand Medicaid in Missouri and add up to, 300,000 Missourians? Some numbers vary, but a lot of Missourians to the Medicaid rolls. And Chris, you have compared that to red meat, that money, the federal money, and predicted that the legislature will pounce on it at some point. Caleb, you've expressed concern about sustainability in the Missouri budget. So we know that there have been committee hearings this summer. My question to each of you is there a path forward now for Medicaid expansion in the state?
Your committee went first. You want me? All right. If the question is, the answer to the question is based on fact, then the answer is yes. There's no question that to expand will put more general revenue dollars into our state budget. And the way it does that is we can cover people who are currently being paid for by the state with federal dollars. A good example of that is prisoners who go to the hospital. Today they're paid 100% by the taxpayers of Missouri. If we were to do the expansion, they'd be paid 100% by the federal government. Everybody, almost by definition, who would get covered is working, and they're working at low-paid jobs and they don't have insurance. The question is, and the classic example is the waitress with 2 kids. Is it a good idea to cover? I think it is.
We haven't mentioned amounts here, and it's what, $800 million? Is that what we're talking about?
Yeah, over the course of
3 years?
Yeah, and what happened is basically the way it was designed and the way that we had it before us last year is that the federal government pays 100% of this new population, these new folks, the 230,000 or so. The federal government pays for 100% of that up until 2016, and then it dwindles down to 90% by 2020. And so part of the conversation that was had last year was what do we do beyond 2020? Is it sustainable? Do we feel like that if in fact if things go the way that they go, would there be some money that we'd have to take away from education to give to this? Those were some of the questions that we asked. I think what we have done over the summer, and I was on one of the 2 interim committees that traveled the state and heard testimony, really a really good experience for me. And what we've done this summer, part of what we wanted to do last year was say, okay, we have this window of opportunity in Missouri, we think, to fundamentally change and make better our current Medicaid system in our state. We'll never have as much leverage as we do right now to make changes to the system because the federal government is willing to work with states. We've seen it through some waivers that they've granted other states. So they're willing to work with us, willing to give us some freedom, probably not freedom in who gets covered and the things that have been prescribed as the ACA goes. A lot of that stuff won't change. But I think there are some changes that we can make, and so we've gone through the process. Jay Barnes, who's a representative from Jefferson City, has really been leading the charge on that, and I would expect him this year to present a bill that takes into account what we heard during our committee hearings, what they've heard in their committee hearings, and something that we hope would make some fundamental changes to the Medicaid system, make what is being delivered to these folks that we add to the rolls, make it better, the best outcomes.
And the committee you served on actually made recommendations to
Yeah.
Representative Barnes' committee.
Yes.
What sort of changes are we talking about?
Well, I think there's some, and I'll let you hit this too, Chris. I think that there are some things that we can do in shifting some costs from that were traditionally, Chris mentioned it to some degree, state cost, shift that over to the federal government. There's some things that we can do there. There have been some ideas in expanding managed care beyond its existing corridor that it operates in now. I think there's some fundamental things that I think if we can agree on provides the path forward that you asked about. It's not an easy path forward. I don't think, but I think it's there.
Caleb is precisely correct when he says this is a unique opportunity to make change. Let me give you a specific example. Because of federal rules, anybody who shows up in an emergency room has to get treated. And even though it's not an emergency, hospitals have very little discretion about that. The result of that is almost 50% of all the Medicaid money that is spent at hospitals is spent by 5% of the people in emergency rooms. We would like to see a greater degree of flexibility on how emergency rooms operate. Can you do more in urgent care? Can you just send some people away? I'm sorry, Mrs. Smith, this is not an emergency. I think you should be able to do that. Because if you think about how big that number is, 5% of the people are spending 50% of all the Medicaid money spent in hospitals. And it's three kinds of groups of people. One, it's people with serious mental illness issues. Two, it's people with serious alcohol or drug issues. And three, it's people who are profoundly sick or injured or whatever. The last group nobody argues with. But those other two groups, there's much, much more efficient ways to treat mental illness or drug addiction than in the emergency room, and much cheaper.
Well, that's a federal requirement, right?
Yeah, and I think...
Has there been evidence that the feds are willing to give on that?
There are certain things that the federal government can grant waivers on, and we're in the investigative process to figure out whether or not that's an area where we could get a waiver. I think we should try to get a waiver in that area.
Mm-hmm. You're not aware of other states that have gotten that waiver?
No, but part of the reason for that is we're so early in the process. Nobody knew this was going to come about. This came about because of the lawsuit. The United States Supreme Court said that the ACA, Affordable Care Act, is constitutional, but that you can't force states to expand Medicaid.
Right.
So that portion of it is a state decision, and nobody knew that when the bill was written. What they did is they took a lot of money away from hospitals that was paid directly in terms of uncompensated care,
Right.
and they moved that money into payments for the working poor. But if we don't expand so that the working poor can get treated, hospitals and other healthcare providers don't get that money. That's a huge problem for mental health.
Are hospitals already experiencing that gap in reimbursement for uncompensated care?
Oh, yeah, this is going, if we don't expand, it's going to cost Columbia, Missouri, $30 million.
Next year?
Yeah, in 1 year.
Okay. You're on the committee that's actually writing a bill for the House.
Caleb's committee went around the state and gathered information, and the speaker wanted to get as many people involved in this as possible. So they then passed on the information that they gathered to our committee, and tried to craft a bill that works. And of course, there's a lot of philosophical differences on this. This is a very tough job.
Mm-hmm.
And Jay Barnes drafted an initial bill last year that kind of started the process. It made some of the changes that he's proposing. I think he's going to propose to make this year. Last year, the bump only went up to 100% of the federal poverty level. where the federal government is saying you got to go up to the 138. So I think this year it'll go up to the 138. And they're doing I think the federal government will allow some wiggle room on how we provide the care for the 100 to 138 population. Because they're making, by no means making a lot of money, but they're making enough money that maybe just throwing them on Medicaid's not the right answer. Maybe it's not the best solution for them. Maybe it's not the best solution for us as a state and as far as dollars go. So, I am all for and have applauded Jay numerous times for, coming up with a solution that's ours. Creative, out of the box type of solution that allows us hopefully to provide better care for these folks if and when we go down the road of this reform and expansion. And he's really done a fantastic job in the midst of a very, very tough, as Chris said, philosophical environment to say, okay, I'm going to tackle it. Let's talk about numbers, and we'll be faced with that reality, I think, next year, and it'll be an interesting debate for sure.
Has the governor engaged in shaping this at all? Is this something that you think that he will be in favor of?
Well, first, let me say that Caleb's right about Jay Barnes. Jay Barnes has done some of the finest legislative work that I've seen in my entire time in the legislature, going back to 1982. His work has been exemplary. The governor's been a steadfast supporter of expansion, and I think that's good. I could wish that perhaps he were more directly involved with the legislature on it, but he's got a very dicey road there, because there's a lot of people on the other side of the aisle, where the majority is, who, if Nixon likes it, they're not going to like it. And so he's got to be careful of that, and that's a very narrow line to walk.
Okay, we're going to switch horses now and talk about another of the governor's priorities, and that's funding for education. Increases for both higher ed, and he has said that he would like to fully fund the foundation formula for K-12. What kind of obstacles, is there any support for that first in the House?
Well, there's a lot of support. I kind of am glad that the governor's coming on board for this. We've been doing this now for 4 or 5 years. We've been increasing the funding for elementary and secondary and higher education, and I'm glad he's coming along on it. It's time, and I hope we can do some good on it. We have not seen his specific proposals, and how he intends to do it is at least as important as the amount of money he tends to put into it.
Caleb, that initiative of his it seems to me, flies kind of in the face of the majority initiative for tax cuts.
Yeah, I mean, on the surface, maybe, yeah. I think, what you have down there is a lot of people who, philosophically, for me, I'd like to see the foundation formula funded. I think that makes good sense. It's you can make the argument that it's a constitutional requirement for us to fund education before we move on, basically. And so, you won't get a lot of opposition from either side of the aisle. You probably get some, but to say, yeah, we want to fund it. So the question becomes, and what Chris said is important, how he wants to do it is really the whole discussion that needs to be had, because just to say I want to fund it, well, I do too, and I want to provide as much money for Mizzou as I possibly can, but you have to find a way to do it. And I think it's important to remember that, and Chris can attest to this because he was there, the budget battle from 2008 and 2009 and 2010, when the recession hit and everything was going down the drain. The legislature was the reason that higher ed and K through 12 didn't get slashed. Frankly, the governor had other ideas for cutting, literally at some point, hundreds of millions of dollars from higher ed, and through the good work of our Senator Schaefer and Chris and others all throughout the legislature, we were able to, ease the burden of that a little bit. And so I think I'm all for. I'm willing to work with the governor on any of this stuff, but I think we have to be realistic about where the money's coming from. This is going to be this will be a decent year for us, I think, revenue wise. Last year was obviously a good year, and so there is a chance to do more than has been done in the past few years, and I think there would be a strong appetite from a lot of people to do that.
Let me give a specific example of what I was talking about before. The least attractive and sexy funding for higher education is the most important piece for higher education. That is the general operating budget for each of the schools. Well, nobody is interested in that because that's the lights and the tuck pointing and paying the janitor and paying the chancellor, and that's not interesting. It's much more interesting and exciting and politically pleasant to fund new and innovative things. But
point.
what we do when we do that, we necessarily carve away from the core funding for the institution. And so I've always been a strong supporter of funding the core of the institution and then let the university or Missouri State or whomever make the decisions about how they want to use their money. I think of our job as getting the money to the schoolhouse door. They ought to decide how it's used after that.
Okay, tax cut, there was a pretty contentious issue last year.
Putting it mildly, I think.
Yeah, governor vetoed it and it was upheld, barely. What do we expect this year?
You're going to see, so part of the debate last year on House Bill 253 that Chris eloquently conveyed many, many times was there were some drafting errors, there were some issues, no question about it. And I think you'll probably see someone, I don't know who and I don't know what the strategy is, someone will probably strip out those blaring errors and introduce a similar bill. I think there will be other proposals. I'm working on one with a couple of folks from both sides of the aisle that would find, I think what you have to ask the question is, okay, if we're going to cut taxes, if there is an appetite for cutting taxes, which that's a philosophical thing too, but if we want to move down that road, the first question you have to ask is, where do we think that cutting will do the most to get a return on what we're doing? Is it corporate taxes? Is it individual taxes? You have to ask those questions. And then you say, okay, with that being said, you come to that conclusion, and then are there other things that we can do? Are there other places that we can draw from to provide some revenues to close the gap that will inevitably come from cutting whatever tax you're going to cut? And I think that there are some areas there. Chris and I have had the conversation about taking a really strong look at tax credits. Right now, we spend upwards of $600 million on tax credits in the state. And I think that there is some work that could be done there to take a look at the tax structure and the environment as a whole. You're looking at rates and you're looking at structure, but you're also looking at the credit side of things and the incentives. And I think that there's something that could be done there, along with some other things to maybe close the gap and make it to a point where education institutions aren't scared that their funding is going to be yanked out from underneath them. And I think we could be wise, and I think that there are folks who want to try and get a tax cut bill that has a broader coalition of support behind it. And I think that's possible. Whether or not it moves remains to be seen.
Look, I'm opposed to all this tax cut talk. We have 100 school districts in Missouri that aren't teaching any foreign language. Harrisburg, right here in Boone County, is teaching 4 days a week. Nebraska lost its AAU rating, and that could happen to the University of Missouri. We're killing our own economic development by decimating our public education from kindergarten through graduate school. But I'm not in the majority, and I understand that. And if you're going to do a tax cut, I think the kind of things that Caleb is talking about make some sense. Can we approach revenue neutrality? And you can do that in several different ways. One is the tax credit idea that he mentioned. That's also a favor to the governors. Another one is the tobacco settlement. If we could deal with, and that's an incredibly complex thing that we don't have time to get into here, but it's very big. It's about a $58 million a year deal. If we could make progress there, that would be worthwhile. Another one is internet sales tax. If we could go there, we could do a cut in income tax, for instance, and do some revenue neutrality. If you could get to revenue neutrality, then you're starting to get where people are working together for the good of the state.
I see. Bond issue for capital projects?
We both hope so. Our infrastructure in the state of Missouri is in terrible shape. Our highway infrastructure is in bad shape. Our public buildings, Fulton is a disgrace. We need the engineering school here. We need the medical school in Kansas City. And we need to fix the state capitol. We've got a lot of important public buildings that we gotta fix. Gotta fix our roads. And our utility infrastructure in the state's in bad shape. Plus, we're looking at the lowest interest rates literally since 1800, and we got a lot of people still out of work. This would dwarf every other job bill for the last 25 years if we were to do a bond issue. Plus, at the end, we would have something worthwhile. We would have an engineering school. We would have a real live mental health hospital in Fulton. We'd have a medical school in Kansas City that was not falling down. These are things that we ought to be thinking about and doing. Our failure to do this is a major, major oversight.
Will you introduce the legislation?
Oh, you bet. And Caleb will work very closely on this.
Yeah, I think, when you look at the polarization in politics has gotten to the point where it's either we're spending more or we're cutting more. It's one or the other. And I think what resides somewhere in the middle is, the government needs to be efficient and needs to do what it's supposed to do really well. And I think in this case, there is an incredibly strong case to be made for what Chris has just said. There are strategic investments that we can make as a state with the dollars that taxpayers entrust with us. Interest rates will not be lower again, as far as anyone can tell. These projects that Chris has talked about are important projects. They're big projects. They're fruitful projects that will allow folks to go to work, will allow things to expand and private sector growth as well. And so, yeah, I don't see, and frankly, it passed out of the House last year.
It's passed out of the House twice in the last 5 years.
And so I think maybe, where I've been making calls to fellow legislators the last few days and getting some ideas and trying to start getting that ball rolling again, and we need to do it. Absolutely.
Was it died in committee in the Senate? Or did it make committee?
It never gets important enough.
Yeah.
It gets on the
And
calendar.
it didn't get out of the House until the last week.
We need to move
either.
it much quicker this year.
And for me, I think we spend too much time on dopey stuff and not enough time on real stuff. The bond issue is real stuff. Think for a moment about healthcare professionals in the community colleges. We bring 100 nurses a month into the state from outside. You know why? Because we don't have the facilities to train them. Now, I want the facilities at Moberly and the other community colleges to be able to train healthcare professionals so that we can hire Missouri people into those jobs. That's incredibly productive economically. Those are good jobs out there in rural Missouri.
You bet.
Yeah.
Okay, we've just got a little time left. Let me ask each of you, what are the things we haven't talked about that you are looking forward to this session or you think will be important? Silence.
Yeah. I know last year we had, it passed out of the House, there was a proposal to put it on the ballot to raise the state sales tax by a penny for a period of time to fund the rebuilding of I-70,
Right.
infrastructure projects as far as transportation goes. I don't know where that's going this year. It didn't pass out. It got filibustered in the Senate, so it is unresolved business. There's no question that we have to do something about I-70, and we have to do something about the shape of the bridges and, again, what Chris was talking about. There are serious infrastructure needs that we as Republicans can't just turn our back on. Now, we can be sensitive to the overall dynamic of where the money's coming from and make sure that we're being fiscally responsible, and I think all of that is absolutely necessary. But there are still things that need and have to be done. And I think we just have to be mindful of that. And you're going to set priorities, and not everything's going to happen all at once, and everybody's going to have to be okay with that. But we, I think, as the majority, need to make sure that these types of things, bonding and those sorts of things, are A1 on the priority list, because they're wins, frankly, for everybody. So I'm hoping that that's the case next year.
As you probably know, I'm heading for the barn here.
Yeah.
This is my last go-around probably. And I don't want to spend too much of this last year on naming the state bunny. I would rather deal with our huge problems with utility infrastructure, for instance. We're in bad shape in that area, and it's invisible. It's not sexy. All this I know I talk about infrastructure all the time. It's because in the last analysis, it costs you a lot more if you don't fix it.
Sure.
And that's what
And
I'm
it's crucial
devoted
for
to.
economic development.
It sure is.
Okay, well, thank you both, gentlemen, for joining us. You've given us a look into the 2014 session. We all hope it's productive, and we appreciate your work on behalf of Columbia and Boone County.
You bet.
Well, thank you, sir. And thank you.
Yeah.
Thank you for joining us tonight. Until next time, good night.